Good evening, welcome to RAAONLINE. Today we'll see other simple cyanotic congenital heart disease, Truncus arteriosus. So definition of Truncus arteriosus, a single semilunar valve which give rise to a common arterial trunk from which arises the aorta, which give rise to systemic arteries, pulmonary arteries as well as the coronary arteries. It is because of the failure of development of the spiral septum. So the spiral septum continues from the outlet portion of the ventricular septum, that is it forms the interventricular portion, the outlet portion, and it continues as the bulbar septum, and it also continues in the truncal portion as a truncal septum, separating the aorta from the pulmonary artery. So the outlet infundibular, bulbar, spiral septum or truncal septum or a continuation of the same entity. So there is failure of development or insufficiency of the spiral septum resulting in truncus arteriosus. Since there is deficiency of this portion also, the truncus is commonly associated with the outlet type of ventricular septal defect, which is usually non-restrictive. So there is admixture at the level of the ventricles, that is subtruncal level there is admixture at the ventricle and there is admixture of blood at the truncus. So two level admixture lesion resulting in cyanosis. We'll see one by one the embryology, anatomy, associated defects, classification system and clinical presentation. We'll start with the embryology. So this is the truncus, common truncus, which is going to become the future aorta and the pulmonary artery, main pulmonary artery. So this is a oval shaped tube from which arises the endocardial cushions. Like the endocardial cushion inside the heart, in the trunk also there are endocardial cushions arising from the sides, that is right and left truncal swelling and the anterior and posterior truncal swelling. So these invaginate inside, so separating this tube into two tubes. The one which develops in the right and posterior side is the aorta, the one which develops in the left and anterior side is the main pulmonary artery. So this is the valve and this is the mesenchyma, soft tissue of the semilunar valves. So this is normal development of the truncus. You can see the truncal septum and the relation of aorta and pulmonary artery at different level of the truncus. So this is originating from the ventricular outlet to the truncus at different level of the truncus. So from down we can see the bulbar ridges coming from the sides, lateral side, right and left lateral, which invaginate inside, dividing the aorta and pulmonary artery with the posterior aorta and anterior pulmonary artery relation. We know aorta at the level of the aortic valve is right and posterior. So posterior aorta and anterior pulmonary artery. The second bulbar ridge is from anterior and posterior. So the next relation at the next level between aorta and pulmonary artery is right and left. And the next level is the truncal ridge, which is at the truncal level of truncus arteriosus. The artery origin has come. So here also it is from the lateral dividing aorta and pulmonary artery. Aorta lies anteriorly here, while pulmonary artery lies posteriorly. So if you see aorta anterior, pulmonary artery posterior, then aorta comes to the right and then pulmonary artery comes front. It is like both the great arteries are entwined across each other, which we have discussed earlier in multiple sessions. So this is a relation, the relation between aorta and pulmonary artery changes from the valve level towards the truncal level. So that is why this septum is not like a simple curtain, it is a very complex system of a spiral curtain which is forming between the aorta and pulmonary artery with variable relation of aorta and pulmonary artery across the septum. So this you can see it is spiraling. So the relation of aorta pulmonary artery comes from anterior posterior lateral towards posterior anterior. So entwined with each other, the aorta and the pulmonary artery. How this truncus arteriosus develops, the embryology. There are multiple theories. Three very famous theories. One, abnormal flow from the vena cava, SVC and IVC streaming during the bilocular stage resulting in failure of development of the spiral septum. Second is abnormal or absent migration of the neural crest cell, which are responsible for formation of the spiral septum. Third is the PAX3 mutation, that is responsible for migration of the neural crest cells forming the infundibular bulbar and the truncal septum.